to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna. While we have the NBA basketball season on, we always like arguing who is the GOAT, the greatest of all time. And one of the variables we always bring into the argument is who is clutch. When the stakes are high, when the weight of the world is on your shoulder, when the time is running out, who has ice in their veins? Who has the precision to be perfect under pressure? Even watching these buzzer beaters is enough to be anxiety inducing. However, did you know that there is one subspecialty of radiology which is very similar? One subspecialty of radiology where every second matters and time is running out. These radiologists, these heroes, they are clutch. They save the day and also save the night. They have ice in their veins. They are the interventional neuroradiologists. What is interventional neuroradiology? How does it save lives? How does it impact human evolution? To answer these questions, we have with us Dr. Pascal Mosimann, Division Head of Neuroradiology and Fellowship Program Supervisor of Interventional Neuroradiology. Pascal, it's great to have you here.
Thank you for inviting me. It's a pleasure for me also to talk about my own field. I'm very happy to be part of this interview today.
All right, awesome. So Pascal, before we begin, can you tell our viewers more as to what is interventional neuroradiology and how did you get interested in it and how did you get into the field?
Yeah, it's a pretty young specialty. Dates back to the late 70s, the 80s. So it hasn't been around for that long, but the progress has been tremendous in the field, like exponentially growing to what it is today. So in a nutshell, what an interventional neuroradiologist does is use brain, head, neck, and spine imaging, first of all, to diagnose procedures who have either too much blood flow or not enough, and then use interventional techniques, minimally invasive techniques, to access and treat those pathologies. So this can mean going through the wrist, going through the arm, going through the leg, or directly through the carotid sometimes. And nowadays it also sometimes is combined with open surgery to do hybrid procedures. So it's a field that is in constant evolution, which makes it fascinating in that regard too, because it seems like it has no limits.
That's very, very interesting you put it like that because you just simplified the whole thing in a nutshell. Either there is too much flow or there is too little flow. And it's almost like asking an expert mechanic, hey, how do you deal with stuff? Either turn clockwise or anti-clockwise and you cannot fix it. But I assume that it's one of the most challenging specialities in radiology as well as probably in all of medicine, given how intricate the whole thing is. And how did you get into it and how did you get trained in interventional neuroradiology?
Yeah. So it started, I guess, in the field of radiology, but when I started my career, I was interested in neurosurgery. So actually, I thought I wanted to become a neurosurgeon, and one day I got to do an elective at Johns Hopkins, and there was at the time Kieran Murphy, who's now one of my colleagues now here at the Toronto Western, who was the chief there at the time, and another Swiss doctor who's still now over there in the head, called Philippe Gaillou. And I discovered this field where you could treat brain aneurysms and pathologies through a tiny pinhole incision without opening the brain. And I was kind of fascinated by that and the technology that goes with it and the intricate anatomy and just the beauty of all that. And I thought it's so elegant. I think it's something I really want to do. And so I still did a year of neurosurgery, but then because of having discovered that, I inquired, and at the time in Europe, and probably still today, it was difficult as a surgeon to get access to those techniques. So I changed and became a radiologist, thinking, I had these biases in my mind that I'd be in a cave all day, looking at pictures and not talking to people. which turned out to be totally wrong, by the way. But still, I went through radiology training, and then I tried to figure out a place where I could learn this. And so that path took me to Paris, which is one of the birthplaces also of interventional neuroradiology in l'hôpital Lariboisière in the 10e arrondissement. And that's where I met my first mentors, Professor Emmanuel Houdard and Jean-Pierre Saint-Maurice, and they taught me all the basics of the art. And then I went from there to Essen, Germany, to join my second mentor, René Chapeau. The French school has been very present in the field of interventional radiology, still is, and so I was, and so is the German society too. So I was drawn to those people and to those centers who had established themselves, and who also had a lot of autonomy in patient management. Right, it's not typical for radiologists to actually have beds and manage beds and people, but in my training, that's what I learned, and I feel very fortunate to have had this chance, and I want to give it back now that I have the capacity to do so. So I'm very happy to be in this position today and train the next leaders of our field.
That's very interesting that your path to becoming a neurosurgeon took a diversion and you ended up in interventional neuroradiology. It's like, if you can treat diseases of the brain without opening it up,
Yeah.
why don't you? And it's interesting that you speak about Dr. Kieran Murphy. And for our viewers, we did have Kieran Murphy on one of our earlier podcasts. He's an amazing inventor, and he talks about being the essence of bringing out inventions. And the other thing which really strikes me very interesting is when you tell that your mentors taught you the art of this. Because generally we like to think about medicine as a science. But I think you're absolutely right that interventional radiology is the line where art meets science. You have a strong science background of what's happening in the body, but it almost needs an artistic skill of how to get things in the right place, when to open things up and when not to. And it's just a beautiful intersection there. But even this approach of this art meets science, I'm assuming that the approach is different in different parts of the world. And you've been around, you've been in the US, you've been in France, and I think for a while you worked in Switzerland as well.
Yeah.
And now you're in Canada. So how does the approach to interventional neuroradiology change in these places, and what brought you to Canada?
Yeah, complex question. I think the field, has, I think almost everything we do with our hands requires a lot of intuition. And I think when you become really good at something, it becomes intuitive. And I think before you get to that stage, you need science to teach you methodologies to kind of be systematic in your way to work, because you don't want to lose that brain space. You want to be able to have a free mind to be creative and to kind of know, out of all the tools and the techniques you've learned, which one to pick. And then sometimes this comes to you in a heartbeat, like you use that word. And I think that's the beauty of becoming an expert, I guess. But you have to develop it with some, well, like everything, playing, we talk about 10,000 hours to get good at anything, to become expert. So you have to train hard, and I think you have to kind of open your mind also to different ways. So not being too dogmatic is very important in our field. It's good to have beliefs. It's good to have, people you follow and find the right mentors, because it's important to have a path and to have references. But then we all develop our own, I think, personal journey and approaches to how we view things and do things. And so my path, led me to different centers and countries, and I think I learned something every time I moved. So putting yourself in discomfort, I think it's true in life in general, is necessary to kind of evolve. So if you push yourself, you will have access to a lot more than you thought. And so I think having a hard journey is actually one of the best things you can hope for yourself. And you'd better do that as soon as you can when you're young, because when you age, obviously you get other responsibilities, families, other stuff that'll come and require also your attention and your energy. But To come back to now, why Canada? That was one of your questions.
Yeah. Well, how did you end up in Canada here?
So Canada, in particular the Toronto Western Hospital, has been one of the pioneering, or maybe the pioneering site in Canada and North America. Professor Karl Terbrugge came here a few years ago now. He's now retired, but still very energetic, and he injected this amazing energy, and he was the mentor of many people who are now leading institutions all across not only Canada and the States, but actually the world. And so this place, being the birthplace for many reasons of my field, as I mentioned also when I went to Paris, was something that was always very important to me. Um, I think traditions have some importance. I don't think everything should be rooted in there, and I think we need to be able to change. But also, I think it needs to be recognized that we get to where we are through other people's energy, and
And on the shoulder of giants.
yeah, exactly. Being offered, I think, the chance of continuing the legacy of those exceptional people is a big honor. And so I was hoping that I could just bring my own little stone to the edifice, and hopefully help people along the way.
Pascal, that is great. And one day, I really hope that, 5, 10 years down the line or 20 years down the line, I'm interviewing somebody else and they're speaking the same way about you with awe and respect. And you've accomplished so much. But speaking about Toronto Western Hospital, it's one of the biggest stroke programs in North America. And interventional neuroradiologists do play a very, very crucial role in treatment of acute stroke. And I think that's where all these sayings come from, in which is like, time is money is old, like it's time is neurons, because every second matters. Um, how does interventional neuroradiology play a central role in stroke? And what are the challenges that you're facing on an everyday basis?
Yeah, so definitely, I think one of the biggest revolutions of medicine has been mechanical thrombectomy. So the capacity to extract brain clots using mechanical devices. And it took a while because there's been controversies, and it wasn't always as obvious as it is today. Now it's incredibly life-changing for patients who get access to this technology, because they can from 1 second to the next, be not able to speak and move one part of their body, and then a few minutes later they're back to normal. So it's fascinating, and like particularly I think in it's generally the older population, and so it's kind of nice to see them see stroke almost as if it were just like a common cold. They come in and they go out and they tell their friends, oh yeah, I just had a little stroke like the other day.
Wow.
I'm back home.
So by mechanical thrombectomy, you mean that you identify the exact site of the block,
Yeah,
where there is a thrombus, and then you go in and you can kind of extract that thrombus
that's
up.
right. Yeah, and there's different ways to do that. Mechanically, you can suck it out basically, or use little stents to pinch it, and then you kind of fish it out.
Wow.
So
Okay.
so it's kind of like, for people who want to know, like in a phrase, what we do is like we're basically brain plumbers. If there's a blockage, and that's what a stroke is, it's a blockage of a blood clot. We just take it out so the flow is restored. And if people come in with a brain bleed, which is another form of stroke, then we make sure that I'd say it's an aneurysm, so kind of a ballooning of an artery that's ruptured. Then we do what we must to kind of close that, obviously fragile zone.
Mm.
And in a nutshell, that's what we do.
Wow. That's an interesting allegory, calling yourself brain plumbers, because it's not just routine plumbing. It's just that the entire house is flooding, and every second delay
Yeah.
can cause irreparable damage in their brains of stroke. So time is going to be of the absolute essence. You just need to be so patient and perfect, but at the same time, very quick and decisive in identifying where the clot is and just going and fishing it out in a matter so that they have the least problems as possible. So, but if I remember my medicine very well, which I did quite a while ago, for some reason, strokes are very common over the night or early in the morning rather than in the middle of the day when everybody's in the hospital, right? So this means that you probably are in the hospital almost 24/7 because you don't want to have any delays. Of course, there are delays in bringing the patient in, but then from the time the patient is brought in till the time the clot is taken out, that time is very, very crucial, which means that you are there 24/7, there are many more Pascals around the hospital 24/7 to kind of take care of it. How is this handled in the hospital?
Yeah, I think that brings me back to the question you asked before. What are the challenges that we see also in the field? It's probably manpower, like you,
Mm-hmm.
or women power. Like just not enough people,
Yeah.
specialists, because it takes a while to get there, and to be trained. I mean, um, but that said, yes, strokes happen basically around the clock. So half of the time we spend is outside of hours,
Mm-hmm.
and the other half is in ours, because there's also not only the emergent procedures, there's also like other kinds of procedures. We can talk about that, but yes, it means it does require 24/7, 365-day service. Generally, most centers have between 2 to 5 interventionalists who take call for that. So it's a lot of, I guess, sacrifice in terms of time, with your loved ones or outside of the hospital. But the passion, I guess, keeps us going. And it's also a field where a lot of other specialties are honing in, because um, neurology and neurosurgery are two specialties who deal with, ischemic and hemorrhagic stroke respectively, and are being attracted to this field, and we're training them nowadays, probably even more so than radiologists. So our field is in constant evolution, as I was saying. So there is that challenge of training enough people, but I think we're going to get there because of the fact that it's growing in more than one area. The other challenge, I suppose, is the resources, because as time evolves, we're faster in diagnosing them, we're faster in treating them, but we still need beds, we still need nurses, we still need technologists, we still need like the whole system to work to be able to treat everybody. And then, like, unfortunately, the distances also in a country like Canada are much bigger than Switzerland. So getting the patient in time is still a challenge. So there's a lot to be done in our field to give equal opportunities for people to get access to the care they need.
Yeah,
But
that's
we're getting there.
that's it's very interesting because the traditional way in which radiologists work is 8 to 6, and then you're on call. But in interventional neuroradiology, you've got to be on call 24/7. But then you also have these other cases which you have, as we were talking about earlier, opening up the veins, closing up the veins, the other AVMs and aneurysms on an elective basis. Those are scheduled as well.
Yeah.
Which means that, let's hypothetically say you're on call overnight and you have 2 strokes overnight, then you're already tired from the adrenaline rush, but you still have to kind of go through the day, so the traditional scheduling kind of seems to be a bit questionable, and we kind of need smarter solutions to that. And speaking of that, we had a podcast with Dr. Mary Gospodarovich from the cancer care, and she was talking about this in cancer care aspect, in which she was saying that we have been operating in silos in specialties, but we actually need to be operating with competencies. That's how we break down silos. And I think you bring up the same point, in which interventional neuroradiology was a subset of radiology, but who cares what it's a subspecialty under? We just need people who are competent to take care of the patient, whether they be neurologists or neurosurgeons or radiologists. If they're able to take care of that patient in the entire spectrum, then that's exactly what kind of people do you need. But speaking of what kind of people you need, do you think that a certain personality type or a certain kind of people lend themselves to being better interventional radiologists? Because, as we point out, it does need a lot of sacrifice. It does need waking up on weird hours and coming into work. It does need eyes in the veins and nerves of steel to be very, very decisive and efficient at the same time. So when you're looking at your fellows, can you quickly tell who's going to be good or not? Or are there any personality traits you're looking at as well in addition?
Delicate question, right? Because yeah, I think we all develop some kind of intuition, again, when we train people or spend time with them. Yeah, I think you can pretty quickly tell who might have more I don't know if talent's the only word, but like maybe a better fit long term. But it's complex because it requires to know yourself, like your limits. And you may have an intrinsic interest for something, but then realize, you're not good at it. You talked about basketball earlier. I always loved basketball. I'm a hardcore Jordan fan, so he's the greatest of all time for me. Like, and not only for me, I think, but I wasn't good at basketball. Like I wanted to make it my career, honestly, but I failed, and I failed early. I was like, only 17. But I think having a passion is, I think, one of the most important ingredients. That's one. But secondly, you have to know yourself. Like, you have to go for it. I think you have to really go for it, not listen to the naysayers who try to discourage you, but then really be honest about it. Like, are you happy doing it, or are you more unhappy doing it? And what I mean by that is, like, when you're in the situation where you're stressed because you may have, caused the complication trying to get, let's say the clot out, but now you've created another complication because you ruptured the vessel trying to get there. You have to be that type of person where, stress isn't going to paralyze you, but it's going to give you that extra kick to kind of like, okay, this situation happened. I have to just deal with it. And I had good mentors who were like, had, nerves of steel basically. And I kind of, it felt natural to them.
Mm.
It feels natural to me. So I think it takes obviously passion. It takes knowing yourself. And then it takes a lot of training and dedication. But if you have the passion, generally, you don't see the time go by. So that's something I think is pretty obvious when you know it. But to apply to yourself isn't that easy always. So I think as a mentor, I think it's also good to kind of guide people and maybe sometimes, tell them that, the path that they chose is definitely a fantastic, choice, and they always take something from there, but also maybe find other talents that they may have not explored as much, and see, do they really feel that it's making them happier, basically being in a room, with a lot of stress around them, um, without affecting their abilities too much.
That's a very perfect way to put it because, as you point out, there are some very necessary ingredients to be a good interventional neuroradiologist. But as you point out, it's not always possible for you to know yourself where you are. And I think that's where very good mentors come in. And you have been a great mentor. You have been a great leader as well. And the job of a good leader is to see where the future is and set course for interventional neuroradiology, not just now, but 10, 20, 30 years down the line. Where do you think interventional neuroradiology is go down in future? What do you think is going to happen 10, 20 years later with such a lot of advances, AI and other things coming in? Where do you see the field going and growing?
Yeah, well, I wish I had the crystal ball, right, to kind of give you the exact picture. But so this is just, a reflection of, the thoughts that I may have at the moment. But um, again, the field that I'm in, interventional neuroradiology, also called now, endovascular neurosurgery, interventional neurology. It has different names now. For a purpose, I think, it's bigger than what it started to be. So I think um, there's nowadays talks about brain-computer interface, for example.
Mm,
That's something that's on the rise. But there's a company who's a bit more actually advanced. The concept is that this company has put electrodes on those same type of stents that we use to remove clots, and they implant them in one of the central veins in the skull, making it not susceptible to clots. So it's funny that we use a device to extract clots, but that we actually implant with electrodes around them to sense the electrical signals that are going up in the brain. And the first goal is to treat patients who have lost function. So typically, ALS, Lou Gehrig's disease. So those were the first patients who were implanted with these devices that could kind of pick up their intention to do a certain action, which now opens the field to kind of science fiction in a way, but it's
wow.
not that far away. So things like moving objects, if they're connected, to your, the right electrode, could be something, that could work. Communicating through, thought, basically, could become possible potentially through this technology. So all these things that we see in movies are probably not that far away. So the era of bionics, could be closer than we think. Some may see this as catastrophic error where you could be hacked and everything, and like I guess all these scenarios may be possible, but it also opens up a lot of hope for people who lost functions, and maybe for brain health, and like other fields that we haven't really seen yet. So I think technology is one area that's going to continue to expand and like lead us to places we probably haven't even thought of. Um, the type of people who do this work, I think we talked about it. I think actually in 20 years, it's quite possible that due to the phenotype of how people choose a specialty, it may be that radiology does not do this anymore in 20 years. Maybe it'll only be neurosurgery, neurology, or maybe a new specialty that flourishes. Who knows? Um, but either way, I think I'm very hopeful for for this field and for mankind, basically, because I think this is only going to get better.
Yeah, this is almost sounds very, very science fiction-y because it kind of seems like a new phase in human evolution. Because I think like humans have transcended the regular evolutionary process because we have our healthcare and stuff. But now we are jumping phases. As you point out, you can implant electrodes, you can read thoughts, and let's say if two people have electrodes, they can communicate with each other, which potentially can bring down a lot of issues which people have in communication, right? Like a lot of problems in the world can be attributed to just miscommunication. Uh, and maybe, one of the things which come out is that we don't need to say, hey, Google or hey, Alexa anymore. You just think about it and the light switches on or switches off. It's so fascinating. And the way you put it is that it might, as you point out, be a completely new specialty or some completely new competency, a group of people kind of working in an area. And as long as they're able to take care of that entire specialty and be innovative enough to push the boundaries in every single direction, as you point out, the field is going to kind of flourish forever. So it sounds very fascinating to me, and I'm sure it's very fascinating to a lot of trainees in radiology or a lot of medical students or aspirants who kind of want to be future Pascals, kind of, be at the bleeding edge of this field. How do they get into this field currently? Is there a residency program or is there a fellowship programs available? And while choosing programs, what do they need to look out for? What are the aspects of a good program and what do they need to take care as to where they're doing and with whom they're doing?
Yeah, so it's not a specialty in itself right now. It's more a subspecialty, meaning you need to specialize first into either radiology, neurosurgery, or neurology, and from there go into a fellowship. And then choosing your fellowship is obviously an important time in one's life. I think everybody remembers their fellowship years with a lot of nostalgia, pride, like a lot of like when we think back to school, it's kind of the same thing, right? It's a very important time of a person's life. So it's important to choose, I think, a place where you get enough volume, because I think you still need to obviously make sure that you can go back, or perhaps even stay, but at least go to a place where you can train enough, because a lot of what we do is requires manual intelligence, and so you need to train that eye-hand coordination muscle pathway.
10,000 hours.
Yeah, so exactly. So definitely that's one important aspect. But I think finding somebody who can coach you and like have the right mindset to make you the best version of yourself is key. And I think it's not necessarily easy to find those people, because it's not necessarily advertised that way. But I think by moving around, doing observerships, and trying to understand yourself again, do you think you're going to be thriving in an environment where there's stress, or do you think despite the intellectual attraction you have for the field, is it really something that you think you're made for? It's difficult to kind of realize sometimes that despite our intellectual inclinations, we maybe actually have other talents. But anyway, I think the key is to find, I think, a good mentor, which can then, or who can then help you build your career and yourself to the max of your potential.
It was a good fit to your personality, the mentor and
Yeah, I
mentors?
think so. Like I like the sports analogy, because I think when you're young, you want to be kind of the captain, you want to be the MVP. You have that fire, you have the drive, and you just want to lead the team. And then with experience, you kind of enjoy actually taking a step back. Having done so many games, that you kind of understand the strategy better, and then you kind of see the who's going to be more helpful than just scoring or whatever. And so you develop this mindset of coaching, or even another circle of the corporate kind of view, where you can see people's talents and how you can shape them to become the best version of themselves again. And I drive a lot of satisfaction in seeing the trainees grow and become better. And so every little thing that I've learned myself, I try to word, and I make myself as clear as possible, so that all the little tips and tricks that I learned along the way, sometimes over years, can just be maybe sometimes summarized in a couple of minutes for them. And like, I'm into simulation a lot now. We're building our own 3D models. We use placentas from donors who have babies and then donate their placentas, and we use that to train
Oh, wow.
people. So there's and I think the coaching mentality is an important aspect of what I do, and I just love teaching. So our program definitely is geared towards probably more advanced fellows. So we typically like to have fellows who already have some experience, so they can get the most out of our fellowship. So
Mm.
bringing them to the really the next level. And again, I think spending time in different environments is always beneficial. So it's never lost, even though people may regret some choices. Sometimes there's always something to get out of the situation. So once you're committed, I think you should go all the way and see where it leads.
Interventional neuroradiology is such a fascinating field. It is high stress, high adrenaline inducing, high rewards. It has the ability to save the patient's life every single day. And not only that, it also has the potential to shape human evolution with all these brain-computer interfaces in future. If you are interested in it, if you want to be a part of this evolution, there's no better place than University Medical Imaging, Toronto. Ladies and gentlemen, that was Dr. Pascal Mosimann, Division Head of Neuroradiology and Fellowship Program Supervisor of Interventional Neuroradiology, and me, your host, Satish Krishna. See you in the next one.